Our clinical officers have issued a 14-day ultimatum to the Ministry of Health and the Public Service Commission (PSC) following claims of non-participation in the decisions made regarding their work and disqualification from promotions. The medics under the Kenya Union of Clinical Officers (KUSO), together with their counterparts at the Kenya Clinical Officers Association, say the recently approved organizational structure and staff establishment by the PSC outrightly discriminated against clinical officers and defied the law on inclusive stakeholder involvement in the formation of managerial instruments. Here is Kate Kelly with that report.
For the union makes us strong.
While taking issue with the recently approved organizational structure and staff establishment for the State Department for Public Health and Professional Standards and the State Department for Medical Services as approved by the Public Service Commission, the clinical officers say that these decisions have oppressed and humiliated them professionally and developmentally. The leaders of the Clinical Union and Clinicians Association (COA) revealed that this is quite frustrating to see that most of them have qualified for promotion. However, according to the decision made by the Ministry of Health through the Public Service Commission, that is considered null. Speaking to the media in Nairobi, George Kibore, the General Secretary of KUKO, said with lack of public participation and their involvement in the decision, as well as the omission of the Directorate of Clinical Services, the establishment had left out critical areas where they are already offering services, hence creating confusion.
We wish to register our collective protest and objection regarding the recent approved organizational structure and staff establishment for State Department for Public Health and Professional Standard and the State Department for Medical Services and as communicated by the Public Service Commission to the Ministry of Health.
Joseph Chebi disclosed that they do not know how these strategies were followed in order to make this decision, adding that 6 years ago, the Public Service Commission devised measures that should be taken to promote these officers to work. However, no appropriate action has been taken to resolve this issue.
We are not aware how these structures are developed. An organogram, now that it went without the participation of healthcare workers who are the implementers, it becomes very difficult to roll out most of the things in the ministry for the good of the ministry and also to bring harmony. Let it be stopped and stakeholders to be called upon and let them make their contribution as it has always happened.
The chairman of these two unions, Wachira Peterson, announced the 14 days deadline for the government through the Ministry of Health and the Public Service Commission to meet up and resolve the issue, stating that failure to resolve this issue, they will be forced to take legal action.
There is a clique of a few people, a homogeneous group that has the same training, have the same experience, but who have come together and they decide on anything that happens in that ministry. We want to tell Kenyans that we have a problem in the Ministry of Health. The problem in the Ministry of Health is that we still have the Mafia House cartel, a group, an exclusive club of individuals who have aligned themselves with whoever they need to ensure that their own interest, and most of the programs that are coming from there, they are not programs that are aimed at helping the Kenyan. They are those that feed into the ulterior motives and interests of that cartel.
The Kenya Union of Clinical Officers have today met to air their grievances on the approval of the organogram in the Ministry of Health by the Public Service Commission. They have given a 14 days warranty period before they take matters into their own hands. Reporting for Hope TV, my name is Kate Andiego.